Hello, hi. I'm Dr. Mohammed Khalil, consultant pediatrician neonatologist. Actually, I'm very happy today to speak to you about care of newborn babies. When I say care of newborn babies, I mean care about the full-term baby, which is born above or equal to completed 37 weeks gestation and a weight of 2.6 kilo or above. For these babies, actually, we do some battery of examination for this baby to make sure that the baby is well. And this including examination of the whole body from head to toe, as this is the first time we came across this baby. So one of the main things which we concentrate on the examination is examination of the eyes, examination of the nose, of the mouth. We see the floor of the mouth to check if there is any something called cleft palate or something like that. Also, we look at the ears, we look at the eyes, we look at the visual busway, which is the light busway from the outside till inside the eye, or something called red reflex. We also examine the heart of this baby, and when we examine the heart, we look at everything about the heart, like if there is any heart murmur, normal cardiac beats, blood pressure, oxygen saturation all over the four limbs of the baby. Important thing again, we look at the examination of the lung and the chest, the examination of the whole skeleton of the baby, including even his fingers and toes, and the examination of his hips to exclude any problem in the hip joint, which might be an early sign of congenital dislocation of the hip. We examine the testicles of the baby, we examine the genital area, we examine the back of the baby to rule out any problem in the alignment of the spine, back spine of the baby, newborn babies. So this is a complete holistic examination of the baby. Besides this, actually, before the baby go home, we tend to do other important investigation, which is hearing assessment to rule out any problem with hearing. Also, another important part, which we call it heel break test or newborn screening. And this newborn screening look for important diseases like sickle cell anemia, like what we call it congenital hypothyroidism, like phenylketonuria, and this makes like any inborn error of metabolism as well, and this give us a good idea about how the baby is functioning very well. Another important part for the battery of discharge of the baby from nursery or neonatal units is vaccination. We make sure that this baby took his initial vaccination, which is hepatitis vaccine first dose and the BCG vaccine against tuberculosis. Now the baby go home, and when the baby go home, there is some important advice for this baby, especially with the new mothers. One of the three important topics I'm going to speak to you about it today, one of them is feeding, second part is sleep, and third part is cry. When we go for the initial one is feeding. Baby is normally fed either with breastfed, or if there's not enough breastfeeding, which is our always preference, is formula feeding. Or sometimes the mother like to mix both breastfeeding and formula feeding. As I said, that the best ever on the earth is breast milk feeding. And but however, if mother cannot do that, she need not to worry a lot, because there is another alternative which is good as well, which is the formula milk. There's a lot of varieties of formula milk feed, which gives the baby sufficient nutrition and also sufficient amount of the needed substances for his growth and well development. Now, some important advice for how to feed the baby. It is important first thing that the mother to know what is position she should take during feeding baby, either breast or formula feed. Baby should be at least in the 48 degrees centigrade, not to be lying on his back, not to be fully erect or fully sitting position. So 45 degrees is comfortable for the baby, would be comfortable for the mother. She needs to learn how to hold the baby in her hand in a good way, make him comfortable, not flexing his neck a lot, not extending his neck, and she herself should be comfortable as well. Going to the baby, if the mother is breastfeeding the baby, she should be able to see the face of the baby while she is breastfeeding. The second important part, if the mother is using the bottle for the formula feed, she should make sure that there is no air going inside the nipple of this bottle alongside with milk. That's how to avoid it, is to make the bottle like 90 degrees on the surface of the mouth of the baby. So in this case, all of the milk will be down and the air will be above. And in this case, the baby will not suck this air. Mother should avoid to give the baby the last meal of his milk. She can just get rid of this. Avoid to give it to him, because if hungry baby, he will suck air definitely along with this few ml or 1 or 2 ml remaining in the bottle. This is very important to avoid colics and gaseous distension, which is more likely will be coming from swallowing air rather than anything else. After the mother does that, she should not put the baby immediately in his bed. She should keep the baby erect and try to burp the baby to get rid of this air inside, which might have went inside the abdomen. This burping process might take 10 to 15 minutes. She should be very quiet, very calm, give it its time, till the baby burp well. Sometimes she can hear the sound of eructation or something like that. Sometimes she may not hear any sound at all, and that's also acceptable. And sometimes the baby, after she finish and try to change position, start to burp immediately, spontaneously by himself. Some babies might bring up a little bit of milk, small tiny amount of milk during this burping process, which is fine. Burping process itself is what we call it is reflux itself, because reflux it's what's called gastrocerebral reflux, is not only fluid, but it is air as well. So should get rid of this air as well, which prevent this milk to come up as a reflux process afterwards. When she does that, I almost always advise mother not to put the baby immediately on the bed as well, but to keep him another 10 minutes in erect position now on her chest, just to get this milk settle down in his stomach and start to get sicker in his stomach, and this prevent the immediate reflux of this milk. After she do that, she can put the baby in his bed. Always we advise mother to get the baby head a little bit up, not 45 degrees, but something like 5 to 10 degrees above the normal. And this should not be a pillow to flex his neck, but it's a continuously head up position. Sometimes the baby might benefit from being put on his tummy, which is prone position, from time to time, and mother should be observing the baby during this time. And this also relieves the gaseous distension of the baby, makes the baby more comfortable, give him some activity for his back muscles as well, and make him stronger as well in the meantime. Another important part here is the mother during feeding. I always advise mother to feed the baby every almost 3 to 4 hours if it's a full-term baby. And in this case, the mother should decide the timing when she's going to feed the baby, but she should give the baby all the time and the sufficient time for the baby to finish his feed. So I control the timing myself as a mother, and baby control the amount how much is going to feed, if it's short or long. I always say that to the mother, don't be erratic. Don't feed the baby now, and when the baby cry after 5-10 minutes, half an hour, feed him again. No, this is not right thing. This is always disturbing for the baby, disturbing for the mother, and will make life not easy at all for anyone, even for the baby, if in this situation. So in this case, what we advise mother, feed the baby roughly every 3 hours. You might be a little bit relaxed within this one, especially during the first 5-6 days in his life. But after that, try to be in time. The baby normally will learn this time and will wake up even if he is asleep at this time to take his feed. One important fact as well is night feeding. Many mothers say that the baby is always awake during the night and sleep more during the night more than the day, and this is, of course, very disturbing. The mother cannot sleep, or mother and father, and this disturbs whole family as a whole. And this will take me directly to the second point, which is sleep. To speak about sleep, normally the baby at the onset of life prefer to be awake more time during night and less time during day. And this is because of the inverted biological hour of the baby, because the mother during pregnancy, normally she's active during the day, and her blood sugar is tending to be on the lower side, and the baby uses this time to sleep. So the baby during the mother activity during the day, he normally sleep and no activity. When the mother go to the bed and start to sleep, her blood sugar start to go up, and baby receive more sugar during this time, and baby became very active, wiggly, and jumping, turning, do everything, kicking, do all these things during night sleep. So when the baby come up after delivery, he need to continue the same. Of course, this is not practical with our life. The most important part here, which I normally advise mother to do, is to avoid feeding the baby a lot during the night. What I normally advise mother from practice from my clinic, feed the baby last feed at 11, 12 p.m. and start to feed first feed, proper feed at 6 a.m., 6, 7 even a.m. in the morning, and give the baby like 6 hours sleep during the night. So what happens if the baby wake up at this time? Only very little amount of feed. I would say not more than 10 ml feed, or not more than 3 minutes or 2-3 minutes of breastfeeding. Gradually, this baby will sleep more, will forget to feed during this night, and get rid of this night feed totally. And if she did like that, then the baby will sleep during all this night. She should be sleeping mother during this time as well, observing the baby, her or herself from time to time, and avoid to feed the baby properly during this time by any means. By this way, baby will sleep overnight, wake up during the day, and then this way he reverted and went up to the normal biological hour, which we all practice. Mother will feel more comfortable, baby will be more comfortable as well. Never mind anything about blood sugar, because this is well continuously maintained during the time. More important for this one is the growth hormone. Growth hormone, and which is normally secreted by the body mainly during night, and this will ensure that proper growth of this baby. So this is very beneficial. One important part, which will take me to my next step, which is cry, is gastroesophageal reflux. Normally during night, there is high tone of what we call it parasympathetic tone, or parasympathetic nervous system. This high tone will make reflux, which is gastroesophageal reflux, more frequently happening during the time. And that's why this baby cry. And that's why this mother feed baby more. And that's why this baby reflux more and go in vicious circle, feed, cry, feed, reflux, cry, feed, reflux, cry, and this spend all the night like this, and sometimes vomiting, and very, very disturbing. Baby cannot sleep, mother cannot sleep at that time, and baby cry. So finishing this point, I'll go directly to the next step, which is cry. So the cry of the baby is mainly during night. And baby cry, why baby cry? Many, many reasons for this one. But more commonly is if the baby wake up during night time, mother is sleeping, father is sleeping, you need to disturb everyone to be awake with him or with her. And believe me, the baby realize if you are awake playing with him, or you are sleeping and he sees that and notice that you are sleeping. And this case, one of the reasons he might cry to wake you up and to start playing with him. This is very important. Second part is this reflux, which is quite painful. And this baby suffers from reflux during this time more because he's fed and cannot sleep. Remember, if you are as a mother, or me as a father, if we are fed late, we have reflux, and we have always problem with our tummy and with our pain in the stomach pain during night. Same exactly the baby might have, and might be more, because the baby food is not solid, it is soft, it is fluid, and this makes reflux very easy. And disturbance of this reflux quite common and quite bad. So what you do actually follow my advice, very minimal or no feeding at all during night, from 11, 12 up till 6 a.m. Baby will be handled very nicely, very well. Try to be a little bit like strong at that time. I know as a Western, we cannot cope with this one, especially in front of the crab's baby. But if you try to practice this and to give the baby a little amount, gradually, day after day, you cut it down till no, and baby will be fine completely. Other reasons of cry is quite common, what they call it, colics. Colics is not as much as frequent as the people might expect, but it shouldn't avoid our thinking this baby is crying. There is some problem which need to be discovered in the baby, either reflux, either the baby have intolerance to his milk, and in this case, you need to seek advice about the milk intolerance of this baby, and the intolerance can be cow's milk protein intolerance or allergy for the baby, and it can be secondary to what we call it lactose intolerance as well. And both cases can give you lactose intolerance, can give you a lot of gas in the abdomen, a lot of distension, discomfort of the baby, and this is very bad pain for the baby. Lactose milk intolerance as well, very painful tummy, a lot of sometimes stool come like fluidy, runny stool with mucus and blood, and sometimes even translated as constipation and distension of the abdomen as well. So this is again something which the doctor need to look at it and see if there is any problem with this one. Other reasons, as you know, which is other normal requirement, and if you can see that it's okay, if you cannot find the reason, you need to go to the doctor rather than simply give this medication for the gases and for colics and stuff like that, and simplify the condition as colics. I'm going to stop here now, although the topic is very broad, but one important thing to do to give you advice about it is the red flags. The red flag here, the more important red flags are a change in the behavior of the baby. By time you will know your baby, how is he behaving? Every one of us is different from the other one. Some people are quiet, some people are very active, some people are doing a lot of activity and moving a lot. Some people are more quiet. So you know your baby activity. Your baby, you know how your baby is able to feed and how much he can finish with feeding. If there is any change in the behavior of the baby, especially regarding feeding, this is very important ominous sign for the baby and can have very bad things about the baby, and you need to seek advice immediately. Another important part is the color of the baby. If there is any color change, say that in a fair color baby, you might find the baby become dusky or less bright like he is, less pink like he's usually appearing or she, and in this case, what we call it bluish discoloration. This is very important sign. You need to seek immediate advice of the baby. Then you can say, what about this dark color races of the babies? And in this case, you always, as a mother, look at the baby's lips and tongue in particular. So get the tongue out, or look at the tongue, open the mouth, look at the tongue. Tongue should be pink color, frank pink color. If there is any duskiness of the color of the tongue, 100% sure this is what we call it cyanosis, and you need to seek advice immediately about it. Another important part is jaundice, yellow discoloration of the baby. Again, this one should be seen by the pediatrician and should assess this degree of jaundice, whether it needs treatment or interference or no. Some of them are mild, doesn't need anything. Some of them are deep, need immediate help with things like ultraviolet light to decrease this level of jaundice and discover why is this jaundice is here or is more prolonged in these cases. I think I'm here give you some more advice. If you like to come and see me for any advice or any detailed advice about your baby, don't hesitate to come and see me. I'll be very happy to support you and give you the sufficient knowledge about what you can do with your baby. Thank you very much.